Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to this edition of Pregnancy to Parenting as we profile a maternity home here in Cape Town, one of the first and if not only maternity home as of its kind here in Southern Africa. It's called Al Nisa Maternity Home, and we'll be hearing more about it as we're getting ready for our 6-week visit, the follow-up visit after birth. And shukran so much to you for staying with us right from the beginning, whether it was choosing a partner, the sexual courtesy we had within a marriage in Islam, fertility, the first few stages of pregnancy, the different months and how baby grows up until the baby is finally born, birth ban. It took us quite a few episodes, alhamdulillah, and series as well, and we're in the second one now, so great success of Pregnancy to Parenting. Now looking at after birth, taking baby home, visiting the baby's first visit, and as well as as mom's 6-week visit. Now from the private sector to birthing at home, the option of birthing at home, to even the public sector, now comes an even better private option to birthing and baby well clinic, with a personal touch, of course, and that is exactly what Al Nisa Maternity Home offers you, the parent or parent-to-be. We will be representing Al Nisa Maternity Home today is head midwife Sister Fozia Samuels. Now, Sister Fozia Samuels is a registered nurse and also with a speciality in advanced midwifery. Ultimately, we'd like you to interact with us, so do visit our Facebook page. It is called Pregnancy to Parenting. With your comments, questions, and queries, you definitely do help us make the show and success of it as well. Let's now welcome Sister Fozia Samuels. Assalamu alaikum to you, Sister Fozia.
Walaikum salam wa rahmatullahi wa barakatuh.
Shukran so much for joining us and representing Al Nisa today and telling our viewers all about it. Very excited to hear about this maternity home, first ever of its kind. Firstly, let's discuss you. Tell us a little bit about yourself, the history behind Sister Fozia, and who exactly is Sister Fozia Samuels.
I started my nursing in the mid-80s at Groote Hospital, and then after completing my general diploma, I went on and specialized in midwifery, and I've stayed there ever since. I was always employed in a facility where it was only midwife driven, so I had that opportunity of being in public in a midwife obstetric unit, and recently I've joined Al Nisa, where I have now the opportunity of bringing all that skills and knowledge into the private side. And then I have also 2 daughters. One is an adult and one is an adolescent. So I think that also helps me just in getting on with my day-to-day clients, also the dynamics. So that is me in a nutshell, and we can just then further on go on to Al Nisa.
Yeah, I know often we don't like talking about ourselves, and I see the modesty shown by Sister Fozia, but shukran so much for sharing that with us. Nobody really likes talking about themselves, but we appreciate Sister Fozia giving us that bit of a background. Now let's get to the nitty-gritties of Al Nisa Maternity Home. Tell us about Al Nisa Maternity Home, when exactly it started, who started it, and why it was established.
It was the initiative of Dr. Anwar Adam. It was a dream, I think, that started 30 years ago when he was still practicing in the Eastern Cape. And it came with his dealings with seeing he was in charge of an obstetric unit. And seeing the difference between how people are being treated in public and then in private, and it was specifically the nuns. So that was a vision that he had a long time ago. And in 2006 they started commissioning and building Al Nisa, and eventually it opened in 2010. Yeah, and it has been growing steadily, and from the time I came in 2012 freelancing, so you can see the steady growth ever since then until now. To date, we have quite a few new services that we've introduced in this year.
So it is advanced as time has grown and the needs that is required.
Yeah, I think in a community, it's something that we've known always. Most of us were born at home with a midwife at home. So I think it is something that has to be reintroduced to the community. And once people are sort of used to the idea, and once it is, people are, and it's more known Like now, it's not very known in, in the community. People know that it's there, but not the amount of people that should know. So
yeah, because a lot of people are going for the private sector because of their personal reasons, knowing that oh, I choose because I think it's a little bit safer. But I think the more knowledge you have, the more safer you can feel about something, and just be reassured, I think.
Okay,
definitely. So the name Al Nisa, because of course it's an Arabic name, and it's got something to do with women, but it's Al Nisa written in Arabic but pronounced An Nisa.
An Nisa, it means the women. So it is a facility that that offers women the option of having the babies with dignity and in privacy. That's how it should be. So it is a unit for women, and it's run entirely by women only.
So safe and private.
Yeah, it is. It gives you that privacy. It is safe, and also and not just for women of specific faith denominations, but it's across board. I feel everyone as a woman should have that privilege when they do have when they are in childbirth, that they can have their babies in a safe and private environment.
And also that option. So the option is available if I choose and opt it, knowing that that was the experience my mom had or my grandmother, and there was no risks involved. So as I said in the intro, I believe it's the first of its kind in the Western Cape and Southern Africa. Is that true?
Yes, it is. We've always had in the Western Cape, and I think other parts of the country as well, that we've always had the midwife obstetric units, but it was always in public. It was in the communities, and it was low risk for low risk birth and pregnancy. But An Nisa is one of the first that we have in the Western Cape, and that is completely private. So now females also have that option of having a normal birth, and if they are low risk, then that is the option for them.
We know the base of Islam, alhamdulillah, and we often try and introduce it to non-Muslims as well. But unfortunately, media does have its play on some of the negativities of Islam. But Islam is mostly peace, and it's driven by a Muslim doctor. We know this, Dr. Anwar Adam. Right. So is it only for Muslim women, and how well does it cater for the rest of the community?
Initially, people sort of felt that it was, but not recently, but there was women from all faith denominations that were delivering there, and everyone is welcome. I think if I look at our clientele now, it is so a vast spectrum of women that we covered, and everyone feels comfortable and welcome when they do come.
So they don't necessarily feel, oh, I'm not from the Islamic faith, I cannot go there. Like they've had maybe at the churches, they would have, mostly, I think, non-Muslims birthing at those type of units. Okay. So
some of the units used to be affiliated to some faith specifically. So you would have those people delivering there, but the doors of Al Nisa is open to everyone. And if you walk in on any given day, you can see not just South Africans, but foreigners, people of all nationalities, colors and creeds. They are there, and I think that is what our faith promotes.
Shukran so much. So just quickly, we've got a minute or two left before we do take a break. Just briefly touch on the services, the other services that Al Nisa offers, and we go into detail after that, after the show. But
we obviously have our antenatal care, then our delivery, and we also have the postnatal care, and that is for mummies day 3, day 5, and day 7 post delivery. And then we also have the days 6 weeks post checkup that we do offer now. And if you look at some of the facilities that we have in the Western Cape, it's a 6 weeks checkup was something that was there, but it's sort of phased out. So we are fortunate that we have it now, that we offer it to patients. Then we also have women's health, where we do pap smears, breast examinations, just for general health for women. We have a GP still that are currently our GP is now on maternity leave, but we have somebody filling in for her. And we also have the Well Baby Clinic that was also introduced in March. And alhamdulillah, that is also increasing. Our numbers are also increasing. We do immunizing and just looking after the general health of the little one.
And where would mommy go for her scans?
The scan, we also have the scan available,
Okay.
And that is your obstetric scan, and then just your general gynae scan we also can do.
So the obstetrics pregnancy scan is going to be done in-house at Al Nisa?
Yes.
Okay.
Yeah.
All right, let's touch on, shukran so much, Sister Fawzia. We're chatting to Sister Fawzia Samuels, head of the midwives at Al Nisa, specializing, at least, she has a great speciality in advanced midwifery, who's heading the midwives at Al Nisa. That is who we are profiling today. Stay with us in this edition of Pregnancy to Parenting. Assalamu alaikum wa rahmatullahi wa barakatuh. I greet you in the name of peace. A very good day to you. Welcome back. This is Pregnancy to Parenting, and we're profiling Al Nisa Maternity Home. If you've just missed the brief introduction on our first segment, it is the first ever of its kind within South Africa, within the Western Cape, and home in Cape Town, based in Rondebosch East. And we'll give the address details and contact numbers a little bit later on if you're interested in contacting them and finding out more about Al Nisa. Just before the show, I at least in the first segment, I introduced you to head of midwives at the Al Nisa Maternity Home, and that's who's representing Al Nisa Maternity Home here today. Let's continue our conversation with Sister Fawzia and find out more about the services offered in detail. But before we discuss that, please mention the makeup of at least the team that makes up Al Nisa Maternity Home and how it is exactly managed.
You have the owner, Dr. Adam, and then you have a board of directors, and that would be his children. And then at the day-to-day running of Al Nisa is from that side we have the administrator, who is Amina, and then we have the financial lady, who is Fatima, and then it's me, of course, and then we have a group of midwives. Every day we have one on for the labor ward side, and then we have our assistants that are working. So, and then we have the receptionist, who is Aisha Maya. So those are the people that you will find every day at Al Nisa. We also have the general workers, and we have two, and on day work shifts as well. So
and on duty, your doctor who's on maternity leave that sees to the well baby, the well woman for other services. The GP, we have her on certain days only. Yes.
And
what doctor is that?
That was Dr. Rabia Parker, and we somebody filling in for her now is Dr. Williams.
Dr. Williams, okay.
Yeah.
And the midwives that is on duty at Al Nisa, delivering and seeing to mommy antenatal visits and the well baby clinic, who are them? Please make mention of their names.
Okay. We have the antenatal clinic. You will find mostly me.
Okay.
And rotating nowadays would be Sister Lillian Gordon, and then we have Sister Tobeka Mondreke.
Okay.
And on night duty we have Sister Angel Mtikati and Sister Suzani. Okay. And then we have a nursing assistants would be Auntie Nazima Stellenboom and Suzuki Swamdini. Okay. And then the breastfeeding, we have a breastfeeding consultant as well.
Brilliant. Okay.
Yeah. But she's also one of the ENAs, and she is Kathy Brandt.
Okay.
And then others that we have that are also filling in, one of the other midwives, the older ones, and that there would be a lot of other ladies that would remember is Auntie Morida Kluti.
Yes.
Yeah. Yes. So that makes out the staff complement. Okay. We also have a lot of ladies that freelance for us. Okay. So sometimes when our midwives are on holiday or not there, you would find a whole lot of other ladies filling in for us.
Because, I mean, birthing does not have a specific time.
No.
So does Al Nisa run on a 24/7
basis? Yes, it is a 24-hour service. The antenatal clinic, of course, and ultrasound does only operate from 7 until 4.
Okay.
So those would be the services only, but the rest of the facility is a 24-hour
delivery.
Yeah,
Bits
yes.
of it.
Yeah,
Because that calls for no specific time.
yeah.
All right, so describe to us the process from your first antenatal visit to the scan, to pain relief options during labor. What happens if there are any complication that arises till the time baby is born, inshallah?
Okay. We always encourage people to book as early as possible.
Okay.
So that they can have early contact, and we can start the education, and we can just start looking after them in general, mom and the unborn baby. So they would book around, say, 12 weeks, have their first scans, and then from there we have now that the clients have five visit appointments with us. So we would see them early, do the early scan, and then they come back at 20 weeks.
Okay.
And at 20 weeks, they have a midwife and a scan appointment. And then we see them again at 28 weeks. If there's any specific tests that they have to have, we bring them back at 24 weeks. But we also give our client that freedom where they can, they can have more visits if they want to. So we leave that option open to them. Then at 34 weeks, they will come back again. We repeat some of the bloods. 38 weeks, and then another scan, and then 40 weeks.
Okay, so you do some more tests at 34 weeks?
Yeah, we just repeat the bloods. Because Al-Nisa, the backup hospitals is your public hospitals, because most of our clients goes to the backup hospitals. We have to keep it in line with the protocols. So we adhere to the protocols of the Western Cape's maternity services. So we will then fit in with those hospitals if they go. So the visits would correlate with those visits. Yeah.
As well. Okay.
Yeah.
All right. And what happens during the birthing process when mommy is now finally ready to pop? Because now we're at the 34-week checkup, and then the last visit, would it be closer to the birth?
The last visit, we always try and make it on the expected delivery date.
Okay.
Because when you get to the expected delivery date, there is that amount of fear and worry, anxiety. So just to bring them in and just to reassure them, put their mind at rest, and also just remind them that there is a period of grace where you still have that 14 days. And if you exceed that you would be post dates. So it's very important for us, and we try always to make it on that day.
14 days is a long time still to carry that 9-10 month baby.
Yes. Yeah, but we from a medical side, it's very important that you reassure, that you just put your mind at rest, but not just the client and the partner, but also the family. And then just to build on that again, just more information around them coming in for the delivery process. Like I said, Al-Nisa caters for the sort of normal pregnancy and birth, the natural one.
The low risk one.
Yeah, the low risk. So when they come into the labor, they are obviously prepared. We also have the antenatal classes that we advise them to attend from 34 weeks on. And in that, we don't just prepare them for labor, but we also look a little bit around the psychological preparation, which is very, very important. It's just to get your mindset around that I am going to have it vaginally and normally and everything. So we sort of focus on that. So by the time the client comes into the labor ward, we'll have enough information and knowledge on at least preparing them a little bit, so that they know and understand what's going to happen there.
Because often the fear arises, but not having enough information.
Yes. Yeah, it is. It is something that would turn your very pleasant, supposed to be very pleasant and beautiful experience into something it could sometimes be even described as horrendous, because it's all that fear. So we try and first get away from all that, and then introduce them. And when they come into the labor ward, then we work around, just educating more and more also. And sometimes you find that it's very difficult, but in most times, that there is still that time to do a lot of education as well. Yeah.
So the actual delivery, let's just focus on the actual delivery. If there are any complications that happens on the day, there's of course, this is a big thing for Anissa to be delivering babies and successfully as well. So talk to us through that process of when mommy is now ready to deliver, and what happens if there are complications, and what pain options do you offer mommies during that time of delivery?
We on booking, we do explain to them that there is the opiates that you can have for pain control. It would be some of the drugs available.
Opiates, okay.
And that would work as an analgesia. So we do have those available, and we also give them information about the risk in taking those. But the main idea is that we would try to avoid using those. So we focus mainly on the natural forms of pain control. Breathing exercises, breathing techniques. There is the water that they can use, sit in the bath and so forth. And then we also have gases that we can offer them, the nitrous oxide that we can offer.
That's the laughing gas.
Yeah, that's the laughing gas, yeah.
My favorite, definitely got me through all of my deliveries at the last, because yes, I was given a little bit of painkillers and the TENS machine and the massaging. And I must say that the personal touch of having a midwife there, you know, it almost feels like a mommy, having a mommy around, but a more medically experienced mommy. In your delivery room.
We didn't give them the safer options, and the gas is definitely the safer options. So a lot of time spent in antenatal is preparing them for that. In the event of there being complications, and that is something that is out of your control, it's unforeseen. So then they either have the option of transferring to their own obstetrician if they have one as a backup plan. Otherwise, they go to the public hospitals, and then we would arrange and present them and the problem, the arising problem, and then from there onwards, that hospital would take over the management.
Shukran so much, Sister Fauzia. Anything else extra that moms needs to know when it comes to the time of baby, that the time baby is born? Even when it comes to having your bag ready, or your daddy being ready, what sort of partnership? I think just let's, in the last few seconds before we take a break, just focus on and mention something about daddy's involvement in that time of delivery as well.
We normally encourage the fathers to be present at birth, and that's why we encourage the birth partner to be your partner. Or it can be whoever you want to, but we encourage the daddies to be there so that the bonding can be instant, but also just in sharing the whole experience. And we also encourage the daddies to be part of the whole thing, like bonding after the baby's born, cutting the cord, kangaroo care, all those type of things. The fathers is always involved. And the segment where they attend the breastfeeding classes, the father attends at work.
Oh, brilliant.
So that is part of that whole preparation of the breast for breastfeeding, and understands the difficulties, that it is a sort of an instinct for us as women, but there is difficulties involved. So that is also part of all that.
Absolutely, Shukran, Sister Fauzia. Let's continue with our third segment after this, and we talk more on the highlighting, and this is pertinent to the stage, and we will be talking about it again in our next show, is the 6-week visit for mom and baby. Often it is missed, and how important is it? It is very important. Let's discuss more of profiling Al-Nisa and the services they offer just after the short break. Stay with us. Assalamu alaikum, welcome back. A very good day to you. And we're discussing Al Nisa Maternity Home on Pregnancy to Parenting today. We have head of the midwives at Al Nisa is Sister Fozia Samuels, introducing us to all the services they offer at the centre, at least maternity home. First of its kind here in the Western Cape in Southern Africa, and we're very lucky to have it amongst our midst here in Cape Town, alhamdulillah. Now, Sister Fozia, let's look at, you've mentioned just before the break, and I know there's a lot that needs to be highlighted when it comes to birthing partners, daddies being more involved, choosing a birthing partner and all of that. But before we get into the nitty-gritties of the emotional bit of the actual birth, let's just look at highlighting the 6-week visit after a baby is born quickly, because often that is missed. You feel fine, baby is doing okay. I mean, even though the breastfeeding was a bit of a problem at the beginning, you find yourself reading more, getting more information, having the assistance of your family or friends, egging things on and making it feel better. But then when you come to 6 weeks, everything's okay, and then you don't necessarily do that 6-week visit. Please discuss with us how important that 6-week visit is, as well as for baby.
The 6-week postnatal visit, the last contact that you've had with your delivering unit would have been at day 7. Okay, so then we send you off, and I think I feel that the importance of that is so that the midwife can just then have a full assessment of mom and baby, but not just the mom and baby, just see how they have been absorbed into the family and into everything. So we're looking after the mom, and we're looking how she has recovered after birth. So we would do the pap smear, we would look at the breast, we would look at whether she stopped bleeding, all those type of things, whether her uterus has involuted and so forth. But we also look at the baby. You see whether the baby has gained, whether the baby's feeding enough, whether she's coping with the baby, if there is any colic or so forth, anything that she struggles with. And that time you can also look at the emotional side of the mom. Yes, which is very important. So sometimes people think that you've had a baby and now the 7 days is finished.
Happy moment for you.
And everybody just assumes that you are fine and you're coping well.
Everything looks good. Baby is beautiful, mashallah. Mommy looks great. Smiling with a new addition, and then they automatically think, wow, things are good.
But when people look at the person with the baby, everyone sort of focus on the baby. So nobody asks the mom, how are you? So sometimes when you just ask, how are you? How are you coping? Then you unleash all that, and then that is where you will find that there is more things that she needs, and then you can you can then pay attention to that, sort of. So that is a very important visit, I feel, not just to check on you medically, but also on your emotional status as well.
Okay, so full checkup.
A full checkup,
medically, physically, emotionally, and in every aspect as well. And hopefully, Daddy is, is attending as well, so he can get from his point of view if there are any issues. Because often Daddy would be saying more of what is actually really happening than Mommy hiding.
And I can see that our males in our community is very compassionate and very concerned, because normally they would be the ones bringing, or phoning and saying something is wrong. So that is something that we value. Sometimes the females from that we've experienced don't always say it, but it would be the males that would come and say she's not managing very well, or phoning very concerned, and especially the breastfeeding lady is very busy. So, but she gets referrals from the daddy, which is good.
That's
which is
brilliant.
excellent.
Wow. I want to talk about the breastfeeding and how that operates, and who the breastfeeding consultant is, because it's very important to know who we're working with. Just quickly, an interesting fact: how many babies have Al Nisa now delivered in this 4 years? I think it is,
close to about, say, over 250.
Wow, mashallah.
Yeah,
that's great. And now during the festive season, you guys are staying open?
Yeah, we are open. Just a week before Christmas and a week before New Year. I think because people are on holiday and going somewhere, it's the emergency services going. And we have a few patients booked for antenatals, like those ones that have exceeded now the expected delivery date. So those would be the ones coming in for that week. But we are open 24 hours. Breastfeeding is also going. Immunizing, we are just looking at our stocks because everywhere people are going on holidays. So
Yes.
we just have to replenish, and then we would be open for immunizing as well.
Okay.
Yeah.
So, but with immunization, I want to touch on your baby well clinic. If
Yeah.
you are late, a week or two, or even a few
Yes.
days, how late can you be to be immunizing your infants?
We encourage them to come at the week that they are supposed to come.
Okay.
But if you are late for some reason, then we just do the follow-up for weekly.
Okay.
So, but as long as your baby has
And
the
you
immunizing.
can't come too early?
No, not too
Not too
early.
early.
Yeah, that is with the antibodies that are developed. So we don't want to interfere. So we give the body like 4 weeks rest, and then we carry on. Yeah.
So is it the same? The Baby Well Clinic, would it be operating the same as what the public clinics operate?
Yeah, we try and keep it also because we have to encourage also our people to do weight checks, regular weight checks, and for the child to have a folder. So we try and keep it on the same schedule. The immunizing is the same scheduling. We also do the developmental screening at the same times. So we keep it so that if they feel that they need to go there, that it's not something that the baby hasn't done or that they would be lacking. So we keep the same schedules. Yeah.
All right, and that of course operates office hours.
Yes, we
Monday
have,
to Friday.
but we only have our Well Baby Clinic on a Wednesday.
Oh, sorry, only on a Wednesday.
So we focus that day. We put that day aside to focus on the babies. Yeah.
Okay. And the little ones.
Yeah.
And how old, to what age up until can mommies bring their toddlers or children or preschoolers, in fact, for immunizations? Is it all immunizations? Because often you get the, I think it's the vitamin A drops and the deworming. Does that also include in your services?
We do the vitamin A drops, and we immunize up until 12.
12 years?
Yes, 12 years.
Wow,
that's the last immunization that they're supposed to have. And then we also do the developmental screening.
Okay, fine and gross.
Yes, and we weigh them. We encourage them also to weigh, but we don't have the deworming.
Okay.
So, but then we would refer them to either the public clinics or we would refer them to pediatricians.
Okay, nice. So now I want to talk about your breastfeeding consultant.
Yes.
Just tell us a little bit more about your very unique services you offer with the breastfeeding consultant, and how does that operate on hours, and what is availability to moms and dads?
Yes, we've looked since I started freelancing. We've looked at breastfeeding. I feel it's a huge problem in our communities that people don't breastfeed. So when we were looking at that specifically, we felt that there was a need. And then looking at your staff, assessing their skills, the knowledge that they have coming from wherever they come. I've identified that there was one, and she's Mrs. Brandt. But everyone calls her Auntie Kathy.
Oh, yeah. So she sounds already like a person of the community.
Yeah, she is. But she has that type of personality. She's got a lot of patience, and that is her passion. For her to see a small baby growing and picking up weight is one of the most wonderful things that she can find, and she gets so excited about it. So we introduced that from this year. She has done quite a bit of breastfeeding counseling courses and stuff, but it was a passion that I checked from her previous work experience also, that she had quite good successes, and she relates so well. So she has quite a lot of successes with mummies that struggle with relatching, babies cup feeding, small babies that are referred from other facilities and institutions, and just coming for to establish breastfeeding. So that is the clinic that we have every day going.
And that breastfeeding consultant, Auntie Kathy, is there every day.
Yes,
something
she's there
you've mentioned very
day.
Interestingly was the cup feeding.
The cup feeding,
Not often you hear that breastfeeding consultants are saying, I know in the hospitals maybe they introduce it when baby is just born, just that the baby needs to know the nipple before anything else. So that's quite interesting.
Yeah, no, she carries, she actually prepares the child minder or or the person that's going to
Oh,
care
the
for the
nanny,
baby,
yes,
yeah, the
okay.
nanny before the mom goes back to work. She
Wow.
prefers them to come in.
Okay.
So what she does is she has sessions with them, introduce the lady to cup feeding, and then introduce the baby to the cup feeding.
So even the baby is just a few months old and mommy is
Yes.
ready to go to work.
Yes.
No bottle.
No bottles. No.
Just express breast milk and cups.
Yeah, she's got
Okay.
this pouch that she's got full of dummies that people donate because they don't need it. So, so they
And
would
no
come
dummies
back.
as well.
No dummies.
Okay,
no,
brilliant.
nothing.
Well
She
done.
only wants them to have the breast only.
Oh, we should
And
have
it's amazing to see how those the ones that persist and carry on. It is possible that they go back to work, but they are still, the baby is not used to a bottle then. So when they come back from work, the baby just naturally latch, and during the day we just have this little sippy cup.
Oh, brilliant!
Yeah.
We should definitely have a session with
Yeah.
Sister Kathy. So,
Yeah.
so I have to keep that in mind. Stay with us as we continue our profile of An-Nisa Maternity Home based out here in Rondebosch, Cape Town. We have more after this short break. Assalamu alaikum wa rahmatullahi wa barakatuh. Good day, welcome back. We're in our last segment as we profile An-Nisa Maternity Home based out here in Rondebosch, Cape Town. We have head of midwives and Sister Fozo, who is specialized in advanced midwifery, in studio with us, profiling An-Nisa Maternity Home. Now, looking at, shukran so much for joining us. We're in our last segment, and just as we have so much fun, time has run up on us. Discuss with us quickly any great milestones or advanced possibilities that An-Nisa is looking at, and perhaps feedback from your patients that you've had there before. What are they saying with regards to their experience at An-Nisa, and maybe some special birth stories as well, just to add light to our profile, inshallah.
Yeah. For us, the milestones that we would like to have is to increase our numbers. Okay, that is one of the things that we hope we would be able to do in the near future.
So looking at more moms wanting to go for the natural birthing option.
Yes, Okay. Then also just to expand more our Well Baby Clinic and introduce maybe smaller little aspects there. We also look, and me and Kathy has sat down and looking at having support groups, which we feel is very, very important. So I feel that a breastfeeding support group would be those moms that if we offer it, would be those moms that are struggling, that they would feel free then and can share with the others, and just have that support. But also just a support group for the antenatal clients as well, so that sometimes it's better if people share things amongst themselves. So without us present, we should be there, but just to facilitate the whole process. So that would be one of the things that we're looking at.
Inshallah.
We have positive as well as negative feedback from our clients, and I feel it is what you as a person wants from the birth. So if that vision or picture isn't fulfilled, then you would have a negative experience. The majority of them that there is positive feedback. We're looking at, when we look and we listen to the feedback, and when we have those coming into us, we try and improve on our service by looking at that. So we use that as a method of improving. Special stories that stands out for me would be the very young client that comes in and delivers so quickly, and not even be aware that she was in full labor, just walking up and down the whole night and saying, I feel I'm going to have a period. The whole time she's saying that, and then I would look at her and she would be so happy. The husband was sleeping, and after a while, then when I examined, she was in advanced stages of labor.
Okay.
And then after the baby came in, she said,
And she didn't even know it.
she said, I was just feeling like I'm going to have a period. But she was initially scared because she, you know, you hear stories from people and they tell you your labor is 5 days and so forth. So she was waiting for all that, and everything went in a breeze. And every time I look at the clients and I think, this is the one that's going to come back quickly because she have a baby so easily. But you don't see, But that one was the one that stands out. Also the clients that now that I recently have is somebody that lost the baby very early last year, and I keep on telling her 4 weeks at a time.
Okay.
So 4 weeks, and we come, then we celebrate. And I say, you can buy yourself a chocolate or something, but we celebrate because you've gone through 4 weeks. And I said, just carry on till 28 weeks. If we can have you 28 weeks, then everything would be fine. So I saw her just before I came. And she's 28 weeks, alhamdulillah. So, but the thing is that even though your client is not a Muslim or so, but you can motivate and so forth. And I say, you go home and you pray, and I pray in my own way. But just that for me stands out, that your client is so, you walk that whole walk with your client. And even though I had to send her today now for further care at the other facility, but we have made it to 28 weeks. So for her was just that we've got that goal, we've reached that goal. And I said to her, now 4 weeks there also, you will come and you will tell me 32 weeks. So we will hold on to, and we must talk to the baby. And because I encourage them to communicate with the little one. So those were the two ones. There is a lot of negativity that we are struggling and battling with, but I always tell Amina, who is the administrator, that if we sit and we look at it, and that would be our way forward. That is how we would understand what it is that we need to do. Because our clients, it comes from a big diversity. The sphere is very big. So we have to look at our clients. You can't have one thing specifically. So you have to treat them from where they are coming from and understand where they are coming from to understand what it is that they are unhappy about.
And especially, like you said, that we've got a big community, diverse community in Cape Town, and An-Nisa has opened their doors to all of them,
to everyone,
not just you know, Muslim women coming for the private and you know, that more hands-on motherly medical care that they need through their birth. So alhamdulillah, may the Almighty grant you and your team the necessary skills to equip yourselves with those sort of challenges, inshallah, and definitely turn the negativity into growth. With the necessary changes that needs to take place. Also, a lot of people are probably asking the questions, you know, do you take medical aids? What are your fees? Where can people find that information? How does one pay? Are there payment options? Do you fall under private? You've said that the owner is Dr. Anwar Adams, so is it an NPO? Where does the fees and monies and options of medical aid come in?
It's a non-profit organization that they have. Currently we are not contracting to the medical aids, but they're having their assessment today. So inshallah, if everything goes well, from next year we might have that option open to a lot of people. And I feel that if they have that option open to them, that more people would want to, because for now they pay cash only. So we have a sort of a global package that we give them, and that is for the delivery and some of the postnatal visits, but they pay antenatal fees. They pay for the ultrasounds and the bloods. Then also the 6 weeks postnatal checkup they pay for, and then obviously the immunizing and the wild woman clinic if they come and they attend. So that is what they currently have.
So looking, I must say, I have to throw in my 5 cents here quickly. I've had, alhamdulillah, very good experience visiting Al-Nisa. When you come in there, firstly, it definitely feels like a home away from home, but with the more professional feel that these mommies, in inverted commas, are going to take care of you. And as you explain the sort of cases that you've dealt with, your hands-on emotional aspect to the visit, to the consultation, adds a different dynamic to it, because women are so scared at this moment of time when they are carrying this baby that everything's okay. There's 101 questions that they can't even possibly think of asking in the consultation. So I've always been guided, when you go and see your gynae or your midwife or even your GP, in fact, whoever's taking care of you at the time, that you list your questions and you put them down, and just as a tip to our viewers, you know, when you go and visit your gynaes or your GPs or your midwives, that you have a little bookie, because at the moment with being pregnant you have such a mush brain, so jot down all that information, or tell your partner or the daddy or your mommy that's going to go with you at your visit, you know, please remind me to ask this and that and that, because when you leave it's like, gosh, I wanted to know about this and I forgot about that, and I was too afraid to ask this and that. So I think that just for once of visiting the midwife, you know, you'll be surprised at the sort of information you will come out of. So alhamdulillah, I'd had a beautiful water birth experience at An-Nisa with a midwife that was there, very loving, very caring, and often you think, is your baby going to be okay when baby comes out? So I've had that personal experience, that the midwives are, you know, has that necessary advanced experience to be looking after that baby when the baby comes out, and even the little bits of complications as well. Quickly on baby, are there any special facilities for baby when things does go wrong, or there are special needs or requirements for the little one or mommy after the birth?
It's the same like with the mom. We transfer if there is a problem that arises during your delivery or even during your birth period, and it is because of the little one, then we do give them the option of transferring to the obstetrician, and then of course they would have a private pediatrician. Otherwise, if they transfer to the public side, then of course there is people that would look after them. Postnatally, if the baby is not managing very well and not coping, we also transfer to the public hospitals. And
often babies are born with a little bit of jaundice. Is that maybe picked up?
The most common thing would be jaundice, and we do have phototherapy available to them.
All right, alhamdulillah, we've literally have 60 seconds to wrap up. What would you say quickly and in conclusion is the ideal candidate mom to be visiting and birthing at An-Nisa maternity home?
It would be your low risk mom, the mom that doesn't have any medical problems, the mom that has good health, the young mom, those would be the ones. And even previously, people that have had previous birth experiences, the ones that had normal vaginal deliveries, the ones that have uncomplicated birth and pregnancy, those would be the moms that you would that would book at An-Nisa.
Okay, and lastly, if anybody within the Cape area or South Africa especially want to come down and see An-Nisa, how can they get in contact with An-Nisa? And do you have a website or Facebook page?
Yeah, there is a website, and we also have a email that they can get into. So that would be info@annisamaternity.co.za. People are most welcome to drop in anytime, and we also have Mrs. Meyer at the reception, is very friendly lady. You can give Aisha a call, and it's on 021-696-8892.
Okay, we'll leave those details on our Facebook page as well. Jazakallah khair to you, Sister Fawzia. Your last words to mommies that's very anxious at this time, you know, looking forward to the birth, and also the importance of the 6-week visit that you'd like to leave us with quickly.
We as women have the natural ability, and it's a wonderful ability that we have. There is a risk of fear, and there is that small risk to it. But alhamdulillah, there is a lot of services available in the community out there, and even at An-Nisa. So we would like to make that experience for you a very pleasant one.
Inshallah. So definitely encouraging more mummies to go for the vaginal birth, and you know, educate yourself, find out more information, and contact maternity homes like An-Nisa to give you the necessary confidence as well. Shukran so much, Sister Fawzia. All the best to An-Nisa and the future plans. Assalamu alaikum. Please join us for our next show as we highlight our 6-week visit and also discussing more on breastfeeding in the series of Pregnancy to Parenting. From myself, Hawa Salman, wassalamu alaikum, and a very good day to you. you.